Hello there. Welcome to my show, COVID-19 update by Heerak for October 9, 2020. And you're listening to music of Soviet Union Army Choir. As you know, Russian Army is very famous for their choir, far more than any other army choirs in the world. People pay good money to go see Russian choir music. When I was vacationing in Montreal a few years ago, I went and saw a Russian choir perform. So they travel and perform now, but it was a way for the Russian army to psych themselves out for war and build morale. As you know, without morale, soldiers will not fight effectively, and that's the same with hospitals. Without people having morale and motivation, hospitals are less effective. As you know, I work as a registered nurse at Virginia Hospital Center, and I've been in a master's of clinical nurse leader program at Georgetown University for 2 years, from 2018 to 2020. I graduated in August. So we have studied a lot about motivation of nurses, nurse fatigue. COVID-19 fatigue among nurses is very high. Some nurses are committing suicide. Some nurses are just quitting or taking a leave of absence. Um, because COVID-19 is putting a lot of strain on nurses, and um, we had a medical doctor who worked in emergency room from Virginia working in New York. She committed suicide. I think it was in April or May. After saving a lot of people, but she did get COVID. She survived it, but then she committed suicide. Um, this 6 month long flu season um, that's coming, October to like May. You're going to have a lot of nurses experiencing far worse than what they experienced in March, April, and May, because most states did not experience it, and New York only experienced it for maybe a month and a half or so, a couple months, and it didn't start out with the height. It built up to a crescendo and kind of decreased. But it's 6 months now. It's going to be horrible for 6 months in America. And during 6 months of flu season, you can expect a lot of nurses to commit suicide. Um, Unfortunately, it's like anything. You know how a lot of U.S. soldiers commit suicide? They go through post-traumatic stress syndrome, PTSD, and the suicide rate among soldiers are very high. These are soldiers who don't kill themselves in the battlefield, but they kill themselves afterwards. So what you're going to have after 6 months of flu season, there are going to be nurses who commit suicide during flu season, 6 months of it, and that's going to demoralize and traumatize their coworkers, obviously, which will impact nursing care in hospitals, and you're going to see that. You got to expect that, anticipate it. If you're a hospital administrator, like chief nursing officer, you should anticipate, half a dozen nurses committing suicide in the next 6 months in your hospital. If it doesn't happen, great, but you should expect it. Um, and worse is, I guess, at a general level, not at a hospital level, but at a general level. After the 6 months are over, there'll be nurses so traumatized, they'll commit suicide like in June and July when, COVID may be kind of at the downward hill, it's not that much. It's like soldiers, they go to war in Iraq and then, they come home and there's no war in America. You're not in a battlefield, but soldiers commit suicide in America, like soldiers who return from the battlefield. And you're going to have that with nurses. Nurses in America for 100 years have not experienced tragedy of this magnitude. So the nursing profession doesn't know how to handle it. American Academy of Nursing, American Colleges of Nursing, American Nursing Association, National League of Nursing, these official professional organizations are not prepared for all the suicide that is coming in 2021 among the nurses. Because I keep up with my professional organizations like NLN, AACN, AAN, ANA, and none of them are talking about anticipated suicides of nurses from PTSD from COVID-19, 6 months of COVID-19 flu season where hospital will be overflowing. They're not talking about it, even though nurses experienced PTSD in New York, because it was only like one state and basically one city. It wasn't a widespread experience. There are 4 million nurses, but this flu season, 6 months of flu season, 50 states will all have nurses traumatized, and 50 states will all have nurses committing suicide at a very high rate. There'll be a big spike in nursing suicides in the next 6 months, and even higher after the next 6 months, because PTSD, while you're going through it, you may not, it's technically not, it could be PTSD, but it's generally after you go through it, you suffer the nightmares and the experiences, because when you're experiencing adrenaline is running. So that's what you can expect in the next 6 months, rise in suicides, and after that, higher spike in suicides among nurses. So you can say that there will be a parallel between suicides among US soldier veterans and suicides among nurses after 6 months of flu season. So, I mean, obviously, you're going to experience PTSD, post-traumatic stress syndrome. If you are in an ICU, intensive care unit, and you see patients dying like every day, many patients dying. Suddenly, the number of patients dying every day spikes up. It may be like you have a patient dying a day, or maybe every few days. But during COVID-19, you're going to have like 10, 20 patients dying every day or more in a single hospital. So you're going to see PTSD. I mean, obviously, there's only so much human mind can take. Only God is eternal and he can take infinite pain without any problem. That's why he created eternal damnation in hell, where you burn forever in hell, because he doesn't, only God is capable of inflicting infinite pain on people. People are not capable of inflicting infinite pain on people because human beings are not eternal beings. We cannot handle infinite pain or infinite trauma, whether it's our own infinite trauma or infinite trauma on others. Like Guantanamo Bay, when they were torturing people, there were US soldiers sending pictures and sabotaging US military, and there are these patriot loyalists who believed in the mission, and they were leaking photos because their mind could not handle it. And it's only 3 days of few weeks of torture. And it wasn't like they did anything serious, really, in terms of torture. I mean, the Inquisition did far worse in the history of Western civilization than anything that went on Guantanamo Bay. Um, you know, uh, yeah, I mean, they say religious wars are the most cruel wars in the world. People do all kinds of stuff for religion. But people love their religion. That's their most important identity. You can't get rid of religious wars to defend people's religions. And that goes for Jews, Muslims, Christians, Hindus. Because India is Hindu and Pakistan is Muslim, and that fuels the conflict, right? Although there are some Muslims in India. So religion is the greatest motivator for individuals, and that is the source of the greatest and most cruel wars. Because people justify wars for their religion, and that's not going to stop. That's just part of human nature. You can't change human nature. Um, yeah. So, but anyway, going back to wars, you can't get rid of wars in human experience. You cannot get rid of religions. You cannot get rid of people's loyalty to their own religion. And you can never change human nature to the extent that people can handle inordinate amount of trauma. That's just not possible. That's why people commit suicide. A lot of soldiers. So you're going to have a lot of nurses committing suicide and after they experience a lot of trauma. They're going to experience it in every state, 50 states. As you know, I'm Heerak Christian Kim, Independent Candidate for U.S. Congress in Virginia's 8th District. And I'm predicting that there will be minimum 60,000 deaths in every state. And obviously, they're going to die in a hospital. So nurses aren't going to see the deaths, over 60,000 deaths in every state. So nurses are going to be the most traumatized because generally, nurses take care of the patients, get emotionally attached to the patients, and they die. Doctors, they don't really take care of the patients that much. They come in, they see them, they leave. They don't really develop that kind of personal relationship. Nurses do. That's why the suicide rate will be the highest among nurses, and the trauma PTSD will be the highest among nurses. And it's sad that AACN, AAN, NLN, ANA, that represent 4 million nurses in America, they're not discussing the coming spikes in nursing suicides and nursing PTSD in the next 6 months of flu season. It's sad that nursing professional organizations don't care about nurses and our needs, to the extent that they are anticipating what our needs will be in the next 6 months of flu season when, we may have, millions, even up to 30 millions of U.S. citizens dying from COVID-19 in the hospitals. Obviously, nurses are the ones who are taking care of that. 4 million nurses in America. And it's sad that nursing professional organizations are so self-absorbed that they're not discussing what's needed for nurses in the next 6 months in the global pandemic. Because that's what professional organizations exist, right? They need to provide services and help and support for nurses if you're a nursing professional organization, but they're not doing their job. And it's sad. Hopefully, leaders of American Nursing Association, ANA, Virginia Nursing Association, VNA, are watching this show, and they will start to address the issue of nursing PTSD during the 6 months of COVID-19 that's coming, and nursing suicides that are coming. They need to address it, discuss it, and have uh, you know, uh, webinars on it. I don't see any webinars. I mean, go to the websites of AACN, ANA, NLN. None of them have it. And NLN, National League of Nursing, is responsible for nursing educators, and they're not providing any kind of resource for nursing education for PTSD during COVID-19 and nursing suicides related to COVID-19 nursing. And that's sad. This is professional organizations have to address the issues that are relevant uh, right now. And what the Israelis say, akshavit. What is right now? Akshavit. Um, right now, nurses are struggling with COVID-19, adapting to it, and now 6 months, nurses will be dying in large numbers, not from suicides, but I mean, there will be suicides as well. And that's why nursing organizations need to wake up and smell the coffee and focus on the needs of the nurses and stop addressing issues that are outside of nursing. Because you're thinking too much about politics, you're not addressing the issues of nurses. And that's the problem with nursing professional associations. They're too much like outside of, they're too much into politics. Get out of politics, get into nursing. Because nurses, 4 million nurses need you. You shouldn't be doing politics right now. You should be doing nursing. Well, meeting the needs of 4 million nurses. And the professional nursing associations are failing nurses, and it's a serious problem. Hopefully, the chief nursing officer at all the hospitals in this area are, uh, they have formed a task force for PTSD among nurses and coming suicides among nursing staff. They need to have a task force in place. What are you going to do? Start forming a task force in the middle of a pandemic when the hospitals are overfilling? They need to form the task force now before it helps. I mean, that's distinguished between superior chief nursing officers and inferior nursing officers. Superior chief nursing officers, CNOs, they're the highest officer for nursing, are the ones who anticipate what's coming in 1 month, 2 months, 3 months, 4 months, 5 months, 6 months, 1 year. That the needs of the nurses. That's what chief nursing officers should do. Those are the superior chief nurses. Inferior chief nurses, they're reactive. They're like, oh, we're not gonna think about anything. And then you have like 12 nurses, RN nurses committing suicide in your hospital in December because they're traumatized by COVID death. And then they try to start forming a task force, but I mean, nurses are committing suicide every week, or every month, or maybe even every day. Um, and the hospital still with COVID-19 can't really focus on forming a task force for nursing suicides when your hospitals are overflowing. Yeah, that becomes a more emergency issue. So you gotta anticipate the coming problems, and you gotta put task force now in place, anticipating the coming problems. So every hospital, like Arlington, Virginia Hospital Center, Falls Church, hospital, I guess, Innova Fairfax Hospital, yeah, Alexandria Hospital, Innova Alexandria Hospital, Georgetown MedStar Hospital, MedStar, Washington Hospital Center, Children's National Hospital, George Washington Hospital, and Sibley Hospital. They all, the chief nursing officers must focus on this. Stop focusing on politics, because that's not an issue right now for America's something emergency from COVID-19. Focus on what you need to focus on. Stop digressing into politics. Stop digressing into issues that's not nursing related, politics related. Avoid politics. I mean, people have different political positions. You impose your political position on your nursing staff. I mean, you could be sued. You could even go to jail if you violate nurses' civil rights. So I mean, stay away from politics. Just focus on nursing. Um, yeah, as United States has the First Amendment, rights and protects citizens through civil rights laws that could imprison violators, organizations that violate First Right Amendment. Sometimes some leaders have this axe to grind about politics and they want to push like the liberal agenda. As you know, I don't believe in the liberal media, but Democrats are hoarding up stimulus checks. Pelosi's hoarding up stimulus checks for you, and she's the Speaker of the House because she doesn't want to help you if her political agenda is not met. Right? That's why you didn't receive stimulus check that you need for your children and yourself. So liberals, there are liberals among chief nursing officers who want to just do politics rather than nursing. That's a problem, right? And that's why, our founding fathers created the First Amendment to protect you from like these despotic tyranny that try to, force you to conform to their liberal views. You know, um, as United States was founded by people who ran away from liberal Christians in England who persecuted Puritans because they were conservative, fundamentalist, evangelical Christians who believed the Bible. And in England, they were persecuted. They were fired from their jobs. They're, for believing very conservative views. And so the United States was founded by Christians who are conservative, who are persecuted by liberal Christians who try to like dilute Christian religion. So that's part of U.S. history, and everybody knows that. That's why majority of Americans are very conservative socially when it comes to marriage between one man and one woman, and about abortion. Majority of the voters are very conservative about these issues, including Democrats. Majority of the Democrats don't want abortion. It's just personally believe that it's killing a baby. That's like majority of Democrat voters. So I mean, people vote for politicians for different reasons, but they have their personal religious views and their personal social views. And Americans are the most conservative social, they have most conservative social values in the world. That studies show, and that's for Democrats and Republicans. And so yeah, today is Scrubs Day. Every year on October 9th, we celebrate Scrubs Day, and scrubs are different now because of COVID-19. The scrubs that you see there are what we at Virginia Hospital Center call enhanced droplet precautions. That is used for patients who are suspected of having COVID-19. Um, and so you have a face shield because, as I've discussed yesterday, if the patient thinks and spit particles goes into your eyes can get infected from COVID, and it's possible for you to go to blind. So you need like masks. So in case patient speaking, and one of the spit particles, when you speak, spit particles sometimes come out, goes into your eye, and you've experienced that, most people have experienced spit particles hitting their face or their eye when talking to people. And that's why you wear a mask, so when patient speaks and the spit particle goes, it will hit the windshield, right? So that's you have to wear like an eyewear or eye protection when you go into patients suspected of having COVID. So they don't have COVID technically, but there's suspicion they may have COVID. And so it's called enhanced droplet precaution. So that's the outfit you wear. You wear an N95 mask inside a face shield, and you wear a gown because COVID-19 can obviously spread through your clothing. So you protect the clothing with a gown, and then you throw uh, your gown and your glove inside the room. When you come out, you gotta clean your face shield uh, with a very strong chemical because obviously you're presuming that outside of the face shield it has COVID-19 on it potentially. But you see, the problem is the women are not wearing like a hair covering, and obviously COVID-19 can stick to your hair. Research shows, and if you touch your hair after you come out, I mean, does that make logical sense not to cover your hair? And see, there are so many problems right now in procedures where, like, those nurses are not required to cover their hair. I don't have hair really. You see, like my hair is really, you know, so not a problem. But like nurses who have a lot of hair, COVID-19 can stick, and that could be a serious problem, right? So they need to, probably require the female nurses with hair to wear a hair covering because, at the height of COVID spread, some nurses may get COVID through their hair, right? Because it's not being covered when they're going to go in patient room. And, when you're taking care of patients' health, they may, you're at close range, right, with the patient. Um, yeah. So today is a COVID, scrub day, and that's the scrub that the protocol that is used for those who are suspected of COVID-19. And the room has a negative pressure, meaning they suck out the air from the room in order to reduce the virus in the room because virus can float in the air. As you know, and we talked about it, airborne precautions. You can see uh, airborne particles, they float across the room and can get you. Droplet, they drop after 6 feet or within 6 feet. Enhanced droplet is like kind of a blending of the two. They created that just for COVID because it's hard to know if somebody has COVID unless they are declared to have COVID. And it's possible that someone has COVID. So you have enhanced droplet precautions for people who are suspected of having COVID, just in case they have it, because you want to protect the nurses, right? So that's a between droplet precaution and airborne precaution. Enhanced droplet precaution. It was created because of COVID. See what COVID is doing to America? Um, yeah, this mask is from Jesus College, Cambridge. As you know, I'm a member of Jesus College for life. And I went to Jesus College and researched Jewish studies. I'm an expert of Jewish studies. And, I ran for a political office, not really a political office, a student leadership. Uh, you know, Cambridge University Student Union, I ran in a university-wide election and won and became the academic officer. So I got votes of undergraduates, graduate students at Georgetown. Uh, Cambridge University Student Union is primarily undergraduate organization, but it's for all students. Graduate students don't often get involved, but as you know, I like to get involved in leadership wherever I am. So at Georgetown University, I ran for vice president of graduate student government, and I won. And I was vice president of Georgetown University graduate student government from May 2019 to May 2020. And I did a lot of important things as a leader of Georgetown University graduate students. There are 9,000 of them. And that was during my master's in clinical nurse leader program at Georgetown, which was for 2 years full time. Um, wherever I go, I become a leader. I run for elected office, So I ran for elected office when I was at Cambridge University. I was the only American in the student government at Cambridge University. The only American in the Cambridge University Student Union. I mean, it's in England. I mean, the country's English, right? English, well, United Kingdom includes England, Scotland, Wales, Northern Ireland. And the fact that I was able to get the votes of English, Scottish, Wales, and Northern Irish people, I mean, there are international students too, but majority were like British citizens. The fact that I was able to get their votes to become an academic officer shows my staying power as a leader, right? Wherever I go, multiculturalism, I understand different cultures. People of different cultures see me as their leader, and they vote for me, you know. So I believe I have a good chance of becoming U.S. Congressman in Virginia State District. We have 100 different nations. Majority of them like me and support me. People of different religions all support me. Muslims, Hindus, Buddhists. Of course, I'm not going to lie. I want them converted to Christianity, but they will still support me because that's, so, people are not like binary. Some liberals, like, I don't believe the liberal media. Liberals think like just because Heerak Christian Kim, independent candidate for U.S. Congress of Virginia District, want to convert people of all other religions to Christianity, people of all the other religions reject Heerak. Right? That's the liberal, like, simple-minded, first grader approach to multiculturalism. They assume things, especially white liberals. They assume like, Buddhists who are Buddhists don't like a Christian who want to convert them to Christianity. They assume it. It's based on their liberal ideology. They don't know these people. They don't know the Buddhists. They don't know the Muslims. They don't know the Hindus. I mean, I come from a Buddhist country, South Korea, right? And all the Buddhists I've known supported me, in South Korea, knowing that I tried to convert them to Christianity. I lived in Israel, and I had tremendous number of Jewish friends. I tried to convert them to Christianity, obviously. They love me. Obviously, when I was in Israel, I had Muslim Palestinian friends. Some of them were in PLO. They love me. They know I want them to be converted to Christianity. As you know, I go to India and I train Indians who are converts to Christianity to become pastors of Indian churches and engage in massive church planting in Muslim and Hindu neighborhoods to convert Muslim and Hindu to Christianity. I do this all over India. I've been doing that for decades. And Hindus love me in India, so the Muslims, So, I mean, these white liberals, they have like this ideology and they think like multiculturalism is like a white thing. It's based on white ideology. It's not like that. Multiculturalism is far more complex than the first graders thinking that white liberals have. These white liberals don't understand us. I'm a person of color. I understand people of color, and I understand, and white liberals, they have this binary black or white, like, oh, if you want to convert Hindus and Muslims, then you're not multicultural. No, it's not like that. Life is not that simple. That's like a first grader approach to multiculturalism. And most white liberals I met, they're like functioning at a first grade level of multiculturalism. They don't understand us. People who are of different cultures, they don't understand. Hillary Clinton did not understand us. That's why a lot of people did not vote for Hillary Clinton. A lot of people who are Black, Hispanic, Asian did not vote for Hillary because we're personally offended by what we call white cultural imperialism, like thinking like their white models of multiculturalism is right, and all of us resent this, uh, people of color who are Black, Hispanic, we find that, Asians, we find it very patronizing that these white liberals think like they know us better than us. And you see that like Nancy Pelosi is kind of like that too. That's why people don't like Nancy Pelosi. People in Hispanic communities, Black communities, Asian communities don't like Nancy Pelosi. That's Mark Kim. If you don't think I'm right, Mark Kim is the Virginia legislator representing Vienna, Virginia. Yeah, I mean, geez, people have these liberal, white liberals think like they're right about everything. They think they're so much superior and better than us. Like they think like these white liberal progressives that they're racially superior to us and try to control us in our lives. Nobody likes that, Nobody. Republican, white, Asians, Hispanics, Blacks, Democrat, Hispanic, Asians, Blacks, they don't like it when white liberals try to control us, with their agenda. It just offends all of us. Yeah, so we have 420 COVID-19 deaths, and it was actually it's a little less than 24 hours, but and I think reporting is still flowing in. Um, so I'm sure at the full 24 hours we'll probably have like 1,000 deaths. Sometimes people report late. It is Friday, TGIF. Um, and so people are a little bit lazier on Fridays. Um, uh, and so confirmed cases are at 7,611,616. Um, obviously it's far more than 30,000 got infected. We have an average of like six, like 40 to 80,000 getting infected every day. So yeah, numbers are still flowing in. Deaths are at 212,840, 3% death rate. Europe is concerning, and I'm sharing photos of my friends from Petersburg or Peterhouse College, which is a different college than Jesus. But I went to a ski trip in the Austrian Alps with Cambridge University students, and I ended up hanging out with Peterhouse, Cambridge students. It was a lot of fun, I generally, you generally socialize with your college, but not many people from Jesus College came. But there were like a whole slew of people from Peterhouse, so I just hung out with them, made new friends, and had a lot of fun. It was like a ski trip for like I think it was like a couple of weeks or something. Yeah, so we had shared dinner together. We had fun together. Yeah. Um, yeah, look at Europe. Europe is in a spike, COVID-19 spike. And Russia is number one in Europe right now. That's why I'm playing Russian Soviet army music. Uh, they have 1,265,572 cases, 2% death rate. They have 22,137 deaths. Spain is number two at 848,324 cases and 32,688 deaths. So 4% death rate. France is 711,704 cases and 5% death rate. And so you have 32,539. United Kingdom has 564,518 cases so far since the beginning of COVID-19, and they have 42,682 deaths so far, 8% death rate. Italy is 338,398 cases, so 11% death rate, 36,083. So, countries with high death rate like Italy, United Kingdom, France, and Spain, they must worry when they start getting higher infections. And that's what's happening now. United Kingdom has like daily like 20,000 infections now. France does too. And the infection rates are going up. So as you can expect, 3 weeks from now, you could have spike in death rate, like 20,000 cases, dying at 8% rate, right? So if you have 20,000 people, well, 10,000 people, 8% is like 800. 20,000 is 1,600. You're going to see a spike in death rate in the United Kingdom. That's coming. Thousands will die every day in United Kingdom and France. Cases are going up, and that's a serious problem for our United Kingdom. It just started this week. Having like 20,000 cases. So 3, 4 weeks, maybe 6, 5 weeks from now, you'll see like spike in death starting. Be maintained for 6 months of the flu season. It's going to keep going up. Um, United Kingdom should probably shut down their nation. So is France, if they want to avoid millions of deaths. But I mean, people like to learn the hard way, right? So what can you do? That's unfortunately, you tell your child not to have a party when you're going to business. They'll probably throw a party, right? And then, people always learn the hard way. Yeah. Um, yeah, United Kingdom is probably going to have the greatest number of COVID-19 deaths again in this flu season at 6 months long. And United Kingdom, Prime Minister Boris Johnson almost died of COVID-19. He could still get COVID-19 again this year. and die this year, that's possible because as we know, COVID-19 can infect people again and again, even in a single year. So, Boris Johnson is not out of the death zone for COVID, and nobody is. If you had COVID in April, May, or March, you can still get COVID again and die. So don't celebrate like, oh, I got COVID in May. I'm not gonna die. No, you can get COVID again and die. That's what World Health Organization says. Center for Disease Control says that too. Um, yeah, I mean that's something all the scientists agree on because they know that antibodies do not provide you with full immunity. So that's 100% scientific fact. So people who got COVID in April can get COVID again and die. Same with New York. Those of you who got COVID in April, survived, you can still get COVID again now, suffer like you did in April and die. Yeah, United Kingdom is at a perilous moment after 17,540 new COVID cases reported. It's in Reuters yesterday reporting, and the significant quote from that is, Health Minister Matt Hancock warned the United Kingdom was at a perilous moment as more than 17,540 new daily COVID-19 cases were reported on Thursday, up by more than 3,000 from the day before. A further 77 people died after testing positive for the virus within 28 days, almost 30 days. Government data showed while the number of COVID-19 patients in hospitals in England rose to 3,044 from 2,944 on Wednesday, the highest figure since June 22. The highest figure since June 22. We are seeing a definite and sustained increase in cases and admissions to hospital. The trend is clear and it is very concerning, said Dr. Yvonne Doyle, Medical Director for Public Health England. As I said, I predicted over a million British citizens will die in the second, or it's actually third peak in America. And, actually globally, it is a third peak. But in the UK, the second peak was kind of low. I mean, they still have people getting infected and dying, but yeah, we really suffered a lot in the second peak. So did India and Brazil. But this is third peak. And it's, I predicted that during the flu season, over a million British citizens will die, and they will. Look at this, numbers are going up. So I was right. I'm always right, as you know. Yeah, I'm the Leonardo da Vinci of 21st century, and I'm running for U.S. Congress in Virginia's 8th District as an independent. I'm not Republican. I'm not Democrat. I'm independent. So vote for me on November 3rd, 2020, or vote for me in the absentee ballot. Vote for me when you do early voting. Align yourself politically with me. Watch all the reruns and see what I say, and just align yourself politically with me, because I provide the keys to the heaven. No, I provide keys to the survival of America in COVID-19. Can I get a 5 on that? Keys to surviving COVID-19 in America. As you know, we're not going to have a vaccine. They say it's going to be March when we get the vaccine, but they'll push the numbers back. I mean, they could rush a vaccine, but it's not going to work. So I mean, it's useless to take it, really. I mean, you can't even damage your system if it's not properly vetted. So yeah, I'm not planning to take any vaccine that's developed less than 2 years. I mean, it's not. I mean, there's a length that you're supposed to take to see if people have side effects. If there's long-term damage to organs. These things are important facts. I mean, you're putting stuff into your body. Yeah, but anyway, yeah, I mean, people don't know what this COVID-19 is. It's acting very weirdly. It gives strokes to 20-year-olds. A lot of nurses will die probably from strokes. 20-year-old nurses, because that's what it does in the next 6 months of flu season. As you know, I'm predicting that minimum 5 out of 25 of 25 clinical nurse leader corps members that I graduated with in August will die before Christmas 2020. I don't think that's an overestimation based on what's going on in America and around the world. So I just want to do a cheer for my clinical nurse leader fellows. CNL 2020, yay! We graduated in August, 25 of us, yay! Some of us may die before Christmas, but at least you can write on your tombstone that you graduated from Masters in Clinical Nurse Leader from Georgetown in August 2020. You can write that on your tombstone, yay! Yeah, I mean, you gotta celebrate the achievements, but we must live in a realistic world. It's not like, oh, nobody's gonna die. Yeah, that's not true because we have like over 1,000 dying every day in America. People are dying. I mean, a lot of nurses are gonna die. Let's deal with reality, or let's not deal in fiction. Um, that's Cambridge University, King's College. Cambridge University is really beautiful. One of the reasons why England is seeing such a spike is they opened the colleges. Heerak Christian Kim, that's who I am, independent candidate for U.S. Congress of Virginia's 8th District, said, don't open the colleges. I've said that for America. I said that for England. As I said, people like to learn the hard way, They don't want to learn the easy way, right? They opened the colleges and now they're seeing the spike. It was expected. Yeah, I mean, Heerak Christian Kim is always right? So that's why you need to vote for me for U.S. Congress. So to go to U.S. Congress and bring facts and choose, because liberal media is not going to deliver the truth, right? You need Heerak Christian Kim to talk the truth and make sure truth is represented. Stop the corruption in U.S. House Representatives and get you the stimulus checks that you need, All these liberals are trying to hold up your stimulus checks, and some Republicans don't want to give you stimulus checks. I'm like, what's the deal? Americans need stimulus checks. Let's give the stimulus checks. So both Republicans and Democrats, they're like in cahoots to hold up your stimulus checks. Absolutely wrong. We need to look into the politics and the corruption in politics, and that's part of the corruption that you're not getting your stimulus checks that you need to survive in COVID-19 America. It's part of the corruption in both parties, Democrats and the Republicans. You need your stimulus check. The thing to do is do everything they can to get you the stimulus checks. I mean, it's not that simple. I mean, it's not that complicated. It's simple. But when there's corruption in government, simple things become very complicated. Yeah, that's why you need to vote for me, Heerak Christian Kim, independent candidate for U.S. Congress. Don Barr is not doing anything to help you survive COVID-19 death, to get you stimulus checks, right? Second article, daily English COVID cases double in a week. Yeah, in a week, it's doubling. Do you remember what happened in March when we talked about cases doubling and then death doubling? Yeah, that talk is coming. We're talking about cases doubling. In a few weeks, we're going to talk about death doubling in a week, death doubling in 5 days, death doubling in 3 days, death doubling in 2 days. Do you remember we talked about that with New York, like in April? We're going to be talking about it again in a few weeks. A lot of people are going to die. As I said, over 1 million will die in England, over 3 million will die in the United States. Minimum 60,000 will die in every state. Obviously, I don't want this to happen, but hey, if you're going to go and party during Halloween inside a building and COVID-19 is airborne, you're going to get infected. Some of you are going to die. I mean, it's not that complicated. If you're going to go trick-or-treating, person who's opening a door may be your killer, meaning they have COVID-19, and just by talking to them, you're going to get COVID. It's airborne, so your mask, like this mask, will not help you in an airborne situation. Yeah, you can wear the mask, still get COVID. If you are, somebody's at the door and you're like within 6 feet, you can easily get COVID even with a mask on. That's what airborne precautions is. Yeah, and COVID-19 is airborne. That's what Center for Disease Control says. That's what World Health Organization says. It is airborne. So just by opening the door, talking to somebody who's at the door, you get COVID, even with mask on. Yeah. Especially like cloth mask like this. Yeah. So that's if the person has COVID, but you don't know whether that person has COVID or not, right? Like if the person doesn't have COVID, you're not going to get COVID. But in trick-or-treating, you don't know who's opening the door. You don't know whether that person has COVID. So if that person has COVID, then you can get it just by talking to that person. Like even with mask on, he has his mask on, you have your mask on, you still get it. Potentially, so yeah, it's a problem. Because masks are not fully protective, right? There's opening somewhere. Well, this mask is pretty good, it kind of grips you tightly around your whole face. Um, but yeah. Um, so this article is by Alistair Snout in Reuters, and that's from today. And the significant quote from that is the average daily number of COVID-19 cases in England has doubled in a week. A survey showed on Friday as scientists warned that action was needed to avert a calamitous and unnecessary spike in deaths. Yes, deaths are coming. I told you not to open up schools, England. I told you to close down schools, Cambridge University, Oxford University. You didn't listen. Now the beautiful Cambridgeshire is going to be filled with COVID-19 deaths. Oxfordshire will be filled with COVID-19 deaths because you open up your universities. Uh, New cases of COVID-19 in England were around 17,200 per day in the latest week to October 1st, compared to 8,400 per day in a previous week. You see, we're heading into 6 months of flu season. So you can only expect it to get worse. It's not going to get better. It's only going to get worse. Yeah. An infection survey by the Office of National Statistics said it's an official government agency research. While another population survey said daily infections could be as many as 45,000. It could be far more than that. Um, yeah. Yeah, in America, we're already above that. But we're heading into flu season, death rates will rise. And England has the misfortune of having a very high death rate. But as you know, Heerak Christian Kim, that's why I am independent candidate for U.S. Congress and Virginia State District. I'm predicting that at least 100 million people in the world will die, and around 3 million to 20 million in America will die. In England, you have, over a million. You could have millions. It's smart to just shut down as soon as you can. You have 6 months of darkness. That's why in the summer, I told people to have fun in the beach, because it's like there's no ceiling, open air. As long as you're far away from people, it's open air, it's hot, so particles will like evaporate, right? Um, but it's not summer anymore. Yeah, and you're like inside. Yeah, you gotta shut everything down. I told you we have to shut everything down for 6 months to reduce that. Even if you shut everything down, people are going to get COVID. uh, See, like you sneeze, right? And some masks will come off if you sneeze into the mask. Um, but it's just and, yeah, it's a bad situation. Um, yeah, just by talking, you can get COVID. Yeah. Anyway, it's going to be very, very bad in the flu season. 6 months of it. Um, and as I've encouraged, try to socialize only with your family unit. The more you meet strangers and socialize with them, higher chance you're going to have of bringing COVID-19 into your home, which can infect everybody in your home and die. Think about it. If 3 million to 30 million people die in America, still 300 million people are not going to die, right? So there are people who are going to survive. Do you want to be in the number 3 million to 30 million who die from COVID, or like 300 million who don't die, right? How you arrange your life can be the difference between whether you end up in an ICU room like this behind me and being intubated with a ventilator or not. That could be you. Behind me, that could be you in a couple of months, right? Yeah. That Russian music is far better with like people singing, not just the instrumentals. I'm just saying, you hear the music in the background, but it's so much better with the Russian soldiers singing. Where's the soldiers? Geez, I feel like cheated out of Russian, Red Army music. It's just the instrumentals. Where are the singers, the soldiers to sing? you know, I mean, but anyway, yeah. I'm glad that you joined me for COVID-19 update by Heerak. It's a daily show, so check in tomorrow. Uh, I'm trying to work hard so you don't become one of these people who get COVID and end up in ventilator and die. I mean, not everybody dies because they go on ventilator. Actually, that's what saves you, right? Like if you get COVID, you should go to hospital because you may die without a ventilator. You need a ventilator and nursing care to survive. So if you get COVID, come to Virginia Hospital Center or any hospital nearby to survive. But ideally, you don't get COVID. That's why you have to aim for not getting COVID, right? Um, yeah. So I hope that you'll take your life seriously, lives of your children seriously. Don't go trick or treating in Halloween that could infect you and your children and get them killed from COVID. Don't go to a Halloween party inside that can get you killed, right, from COVID. Yeah, stay away from Halloween parties and trick or treating. I'm recommending to Arlington County, Fairfax County, City of Alexandria, and City of Falls Church legalize trick-or-treating and Halloween parties. That's necessary as a public health measure going into 6 months of flu season, where tens of thousands of Northern Virginians can die or more. I mean, we can have more than tens of thousands, hundreds of thousands. We need to take the precautions from a public health perspective to curb COVID-19 death. Unfortunately, Arlington County government is not doing that. They're filled with Democrats. What do you expect? These liberals, you can't trust them. I don't believe in the liberal media, and this Arlington County is filled with Democrat liberals. That's why we don't have the measures that we need to prevent your death from COVID-19. It's a shame. They need to illegalize trick-or-treating Halloween parties. Public health requires it. It's science. Species, animals going extinct if you don't take precautions. And, tens of thousands of people can die in Arlington County if you don't take the precautions. Because you have these Democrats in Arlington County boards who don't care about your life. And that's the problem, right? Yeah. Yes, I look forward to seeing you tomorrow. I'll bring you more helpful information to help you survive. So tune in. Make sure everybody in Arlington County tunes in your area tunes in, because there are people who will survive COVID-19, but they're not the lazy ones, right? Lazy ones may die from COVID-19 in the flu season. You need the information, you need the analysis, and you need to take the steps to save your children from COVID-19 death, save yourself from COVID-19 death. So I hope that you'll be well and that your children will be well. And I'll look forward to seeing you tomorrow. Bye.